Gracias, Maribel. Good morning, everyone. Gracias. Thank you to everybody that have made it possible for us to be here. So thank you for joining us. Thank you for being here. Our presentation today will be a combination of English and Spanish, but when we switch language, we will be letting you know so you can switch to the channel as well. Before we start, I have learned, and actually I have learned through my community, the importance of setting an intention. When we have our Promotores meetings, we usually start with prayers, we usually start with blessings. But today, because of time, we're just gonna start with taking a deep breath and inhaling and exhaling, and just being thankful for this moment. It is a miraculous moment to have this opportunity to join you in different places and different settings. I see some names of people that were in a similar presentation that we did last year when we were presenting about this project as a pilot. And today we're going to be presenting a little bit how the project has evolved and what has happened during COVID-19. But before we do that, I want my compañeras, colegas, Delfina and Claudia, just to share a little bit, like maybe at least wave their names. And Delfina, do you want to start? And then I will ask on Claudia.
Yes. Hi, Dr. Zúñiga. Hi, everybody. Yes, we're blessed to be here today. I've been to this conference once when we presented about another workshop, and I really enjoyed just mingling with promotoras de salud from other states. And I'm just happy to see faces because it's something that I cannot network in person. And it's just really exciting to see people's face. I know I'm also the one who's like, okay, now everybody has their camera off. So I'm just like, I'm going to turn mine off because I think it's not the norm right now. But, I'm really glad to be encouraged, that we encourage each other to turn the camera on. I'm happy here with, just taking my shoes off and I can do that. And I'm just like, oh, I hope you're comfortable where you're at. I've been promotora for quite a while, and now I'm in this role of supporting promotores de salud work, and I'm happy to be here. I'm from Mexico. My family's from Mexico, more specifically from Oaxaca. So I see Delfina as well in the audience. I don't see too many people with my name, so I'm like, oh, yay, there's a Delfina there. So nice to meet you, Delfina. Thank you for having us.
Gracias, Delfina. Claudia, ¿quiere decir algo sobre usted, presentarse? And for the community, if you want to hear Claudia, you can switch very quickly to the Spanish language, to the English language, or I don't know anymore how it is. Switch to the language so you can hear Claudia's presentation, introduction. Claudia, si puede, por favor, introducirse.
Hola, buen día para todos. Pues yo feliz y orgullosa de estar compartiendo con este gran equipo de mi comunidad y estar exponiendo hoy para mí es una nueva experiencia, pero me da mucho orgullo y mucha felicidad. Yo soy de México, soy del estado de Michoacán y soy madre de 4 hijos. Realmente ser promotora de salud para mí me ha empoderado, me ha llenado de mucha satisfacción. Me ha despertado el amor y la pasión por mi comunidad y me ha dado muchas experiencias de ver sonrisas en los rostros donde había preocupaciones, y eso me hace cada día sentirme más fuerte, más orgullosa de ser mexicana, de ser michoacana, de ser una madre con muchas ganas de poder darles a mis hijos el mayor ejemplo y con mucha seguridad. Espero que este día podamos aprender más y poder seguir llenándonos de mucha energía para seguir ayudando cada día y buscando metas y soluciones para nuestra comunidad latina. Muchas gracias a todos por estar aquí y espero que podamos aprender juntos y llevarnos una grata satisfacción este día. Gracias.
Gracias, Claudia, y gracias, Delfina. Thank you. Thank you, both of you. My name is Ruth Zúñiga. I am a licensed psychologist. I'm also a faculty member at Pacific University. But most importantly, I am an immigrant and mother of a amazing child, and I have been blessed to being welcome and received in the community in Oregon. And some years ago, we started this partnership between academia, Community Health Division of Providence, and Promotores de Salud, and focusing on bringing mental health to the people and focusing on removing the stigma associated to emotional health and mental health. And so that's what we're going to be talking today about it. And we have the wisdom of Claudia, who will be sharing from her perspective as a promotora. I will be sharing from the perspective of academia, what we have brought to this, and Delfina is going to bring sharing from the community aspect of the Community Health Division. So our intention today is for us to just to talk about our program and hopefully to inspire other people to do something similar, and to also enhance and discuss the importance of collaboration, because our program, it is what it is today just because of the strong collaboration that we have here and that we have done. So I just briefly gonna share the behind the scenes of people in this program. There is plenty, and there is a lot of people that we would like to acknowledge and thank, but just because of time, we're just gonna share very quickly my team, or this psychology students team is here. I just wanna bring their pictures, and their lovely pictures here is part of the people that make this possible, my students and the people of Providence Health System. We have Promotores de Salud as well, and we also have many community partners, and we also have a new partnership with Lines for Life, an agency that focuses on crisis management and intervention, and that's what we want to acknowledge them. But before we start, we like to discuss and hear from you. Many of us know what Promotores de Salud are and who they are, but many of us may not be familiar with that. So we would like, there is in your chat, there is a link that Maribel is going to share with all of us. And we are invite you to go into that link and think about a word that represents Promotores de Salud, community health workers, somebody that represents what is the word that represents Promotores de Salud for you? So if you can go to that link, just type a word, what words come to your mind, qué palabras viene a su mente when you hear the word Promotores de Salud. So just type your word, or type something that it represents that, and I would like you to send it. And I'm just gonna share very briefly for you to see what are some of the words that come to people's mind: compassionate, advocate, advocates, helper, relationship, amor, which is exactly what Claudia was telling us, poder, resources, connection, trust. So the words, it's beautiful to see this word cloud as evolved, but it's still, as you can see, that aspect of advocacy and compassion is at the front and center of how we experience, or what we may think about Promotores de Salud. Puentes, so thanks for those that are sharing here in the chat, culturally appropriate, superhero. I love that, Amy. What a beautiful representation of that. And trusted community member. And so thank you for sharing that. And community health workers, have many names: Promotores de Salud, community health workers, advisors, traditional workers, health promoters. And we know the research, and now we know that the role of Promotores de Salud is just expanding. And as you have mentioned it, they mean to be a representation of the community and a bridge. But we would like for Claudia, we would like to invite Claudia to share with us what does it mean to be a promotora de salud. Voy a invitar a Claudia a que pueda compartir con sus propias palabras qué es ser promotor de salud. So Claudia, le accedo el micrófono so you can share with us what it means to be a promotor de salud. So para que nos diga qué significa ser promotor de salud.
Para mí y creo que para la mayoría, promotor de salud es ser como una parte de la voz de nuestra comunidad, ser ese puente de conexión entre la comunidad latina y las organizaciones de salud sociales y culturales de nuestro estado. Y más que nada, lo que más me gusta es la compasión que existe en nuestro grupo por los demás, sentir la empatía y ponernos en el lugar de las personas para poder sentir sus necesidades, sus preocupaciones y más así ver la diferencia que hacemos cuando podemos ayudarle, cuando podemos guiarlos hacia un servicio que es necesario, más en la comunidad latina que a veces no cuentan con un seguro de salud. Entonces, es importante saber que lo que más existe entre los promotores, lo que debe existir es el respeto hacia los demás, no juzgar, no criticar, tener compasión, tener amor hacia lo que hacemos y crear un ambiente de confianza para poder escuchar y que la comunidad dé realmente su punto de vista, sienta esa conexión con nosotros y podamos ayudar a la comunidad y servir. Hemos creado talleres de tomando control de su salud. Hemos creado también ferias de salud donde podemos brindar a la comunidad ya sea exámenes de visión, exámenes de glucosa, exámenes de colesterol alto, exámenes dentales y más que nada, lo más importante que gracias a las charlas de tomando control de su salud y tomando control de su diabetes, al hacer encuestas vimos la necesidad tan grande que existía de tener ahora sí que la atención de mental, psicológica o como lo podamos llamar. Eso es lo más importante que estaba creando ambientes llenos de frustraciones en nuestra comunidad, depresivos, y vimos esa necesidad de salud emocional y es ahí cuando hubo la conexión con Pacific University y hemos estado bastante orgullosos de nuestros logros, que a pesar de los tabús en nuestra comunidad latina, hemos ido conectándonos poco a poco, creando confianza y abriendo puertas, abriendo corazones y viendo que nuestra comunidad ha dicho presente, quiero la ayuda, necesito la ayuda y eso para nosotros es lo más grande, sentir esa conexión y pues eso es realidad lo que somos los promotores, un puente de conexión hacia las organizaciones para que nuestra comunidad tenga realmente lo que necesita. Eso es.
Gracias, Claudia. Y justamente Claudia nos resume varias cosas aquí. Uno es, oh, you see, I just started speaking Spanish. Oh, great. Just like Claudia summarizes some of the work of the promotores. And maybe if you're a promotor here in this room, I want you to, let's clap for everybody that is a promotor here. Let's actually give yourself a pat in the back, just a recognition for the work that you do. And we understand that the promotores work is diverse and there are many things that you all are doing, or that if you're working with promotores, you're doing different kinds of work. And Claudia summarized some of the different works that promotores are doing and have done for decades. But one of the things that we notice, and as Claudia said, within our community, is that mental health and emotional health being at the front run of the situations that the community want us to address. And because the promotores being a bridge between healthcare systems, we found this unique opportunity to work with promotores and vice versa to help reduce the stigma and the barriers associated to mental health. That because the promotores have this unique position to help to have that bridge, to have that credibility, versus psychologists. At times, we don't have that credibility. We may not at times recognize the true needs and experiences of our communities, but the promotores did, and the promotores do. And it is because of this that we saw an opportunity to work together, focus on creating a program to increase the mental health support for our community, but also to support the promotores' knowledge, confidence, and skills about mental health, and also without forgetting on supporting their own well-being. A lot of times we talk about giving, and we forget the importance that it is and how important it is for the promotores also to be receivers of this wellness and well-being. And therefore, we created this collaboration, this program that started some years ago, and I'm gonna have my compañera Delfina just to share, I think she has a dinámica, but then after that, she's gonna share about this experience that we started some years ago with this program, and we will explain what this program is about.
Thank you, Dr. Zúñiga. So yes, colegas, we have a little dinámica to play with you today, just a quick short one. I mean, I know we're all here in the morning, and I woke up with coffee and I'm here all energetic. And so I need to kind of release some of this energy, and I hope you're kind of feeling the same way. But so we're just going to play Simon Says, and it's going to be quick so that we can all interact. I'm just gonna do some fun movements. Ask actions from Simon Says. So Simon says, touch your head. Simon says, stand up. Simon says, go around your chair. Simon says, lift your feet, your knee up. Ya me voy a poner a bailar, doctora Zúñiga. Simon says, mueve las caderas.
People almost saw that I was wearing yoga pants and not regular pants.
Simon says, touch your shoulder. Simon says, I don't know, just hold yourself, wrap yourself around, love yourself. I wish I could be hugging you all and, los que conozco. And it's really different to be here virtually. But we can all sit down if you like. But I just really looking for ways of how can I interact with all of you guys. It's such a different experience, but we're going to make the best of it. And we're happy to be here today. So as Dr. Zúñiga, mentioning this whole of, just this collaboration that we have built throughout the years, it's a really unique, and I think we hope that it's something that we can all learn from here, is that it's a really unique kind of a partnership where just kind of the really important ingredients came together. I think of it as important ingredients are like promotores de salud, being trusted community, every members, having that relationship, being compassionate, everything that you all said and what Claudia said, what does it mean to be promotor? It's really having that connection with communities already. And here with our Sabiduría program, Pacific University, where this is where kind of, would you say the academia, the expertise of the academia comes in, it holds part of that. And this program is only one of the only 10 Latinx psychology training programs. So that is a really unique way that we have this in Oregon, and they exist here in Oregon, and we can, build this relationship. To really, and also learn together with the promotores about how to, like Dr. Zúñiga said, working together to understand what is that, what types of training, how do you bring this topic to the community that is culturally relevant to them, and also the linguistic skills that, so that it's even more beneficial for the community. The Promotores program, the Promotores de Salud de la Iglesia program, it's a very kind of specific program that it's a Promotores Salud that focuses, are embedded in the local parishes that Providence collaborates with. And we've been, this program has, been in its existence for the past 12 years, building this ongoing relationship with the collaborators, but really promoting wellness and doing a lot of focus in that sense, but also training community members that are from these parishes. So after they go through training to become community health workers, they stay within their community. They're in the same area. And so they really have that lens that a lot of us, we don't have at times, because they're interacting, they're part of the community. So, to bridge that access. And, just a really short timeline of what has been our history with this, how did this initiated this project to focus on mental health and emotional health. Providence does a community health needs assessment every 3 years, within around all its service region. And so, in 2016, it kind of brought that to clarity that there's a need for access to mental health services for the community, and, for Latinx community here. And so the Promotores, they were already bringing this up to us and, at our meetings, queremos enfocar, we want to focus. This is our community needs. We see, I don't know if you guys remember kind of the time frame back then, 2016, 2017, there's immigration, raids going on. There was just a lot of stressors, a lot of, stressors that were impacting our community. And so it wasn't that mental health concerns was not there. It's just, it was just more obvious, more visible, amongst our children, amongst, the community in general. So Promotores, we really, looked for, found ways of, who can we partner with? Our Promotores are asking to be trained. They want to be educated more about mental health. Some of the programs that have been existed was somehow not very, they couldn't relate too much to the information. It wasn't too culturally relevant to them as how they view mental health or emotional health. And so we partnered with, built this partnership with Pacific University in 2018 and moved forward to now coming up with what do we want to do? What is that we want to focus? Pacific University wanted to learn, wanted to listen, joined in meeting with the Promotores. We even formed an advisory group committee here of Promotores that really wanted to move this forward. Were really passionate about it. And, Pacific University held continuous meetings to learn. Us with, Providence, with our collaborators too, we wanted to also do kind of an assessment with the parish leaders and just kind of hear what is that they're seeing. On and on, we heard that the parish leaders, they could only provide so much support on the faith side of on the faith side of what they're, have expertise on, but not so much on the mental health. And bring, show, they're not very sure how to navigate people to access to care for mental health services or counseling, that, this needed an ongoing type of support for them to move through that process. So, so we did that, and that was necessary to kind of start gathering, assessing the situation here, what's happening. And so, later the Pacific University just built this training, beautifully training of, training the Promotores that, or at times that, 30 hours of training topics that are related to mental health. These topics were identified kind of very specific ways of kind of what the Promotores wanted to learn, or what was kind of what we had to prioritize that. What would that be? And here we are. We had to kind of adapt to 2020 with, the pandemic hit. Prior to that, we were delivering charlas, community gathering, conversation, holding sessions in the community, in safe spaces with the community in person. The Promotores were doing this alongside with Pacific University students, and transition had to happen too. We had to adapt to kind of figure out how do we continue on to carry the charlas, bringing the charlas for the community in 2020 during the pandemic. So this is kind of in the history, and we're going to break down into a little bit more on this during the presentation. I think, as I mentioned, again, this is the Promotores programs lives here within Providence, sponsored by Providence Community Health Division. And that's my role. My role is, along with my other colegas, is to support the promotores, move on the work, identify, how do we align with the community health needs assessment, but really intentionally be listeners with the promotores, and they're part of every project that any outreach that we do. It's the promotores are the central to delivering and building that relationship with communities. So meetings it's an ongoing thing. It's an ongoing conversation with the promotores, and also in the trainings of training as well. So after that, we had a breakdown. Like I said, we had a breakdown to kind of, what phases, how do we break this down? So first was to kind of train the community, the promotores, so that they would increase their knowledge and become more comfortable about, built on, skills as well to understand the community's emotional needs. So there was a lot of also personal growth in that. Because for a lot of them, it was kind of the first time even talking about mental health, and at this level with the students and with Doctora Zúñiga in this space during their learning, and also just recognizing how what have been the flags in their families, and it kind of starts with la familia first. You kind of have to break that down. It's like, this is what it looks like. I actually I thought I knew, but I thought I could recognize or I know about mental health, but actually, there's more to this. So, that personal growth really happened for a lot of compañeros that went through this process of being trained. And it's to empower them, and through this, as they kind of start seeing this, they even became even more empowered to really learn how to take care of themselves, the importance of taking care of yourself, your family, and then you can educate your community. And ultimately, that through this road pathway, that you continue to have reduce the stigma associated with mental health in the community. So that's been been the pathway as we move through this work. And I pass it back to Doctora Zúñiga.
Gracias, Delfina. Thank you, Delfina. So as Delfina was saying, the Promotores program, the Promotores, the community identified the need. We came to the picture in 2017-18. And I say we, Academia Pacific University, the Sabiduría program, have already been doing trainings with promotores, maybe going into conferences and trying to learn from them, but just maybe a workshop on a weekend for the promotores on mental health. But then where we decided, based on this advisory board information and their requests, which are all promotores, was we need to divide this program in two things. The first thing will be training the promotores. In addition to the training that they have, is training these promotores on emotional health and wellness, and not a training that will just be based on teaching them, but instead co-learning together. And then once that the promotores will get in this training, the second step will be doing these charlas in collaboration with the students of the program to bring these same topics to the community. So the first step was focusing on the promotores on knowledge and learning, but also empowering and confidence, because many promotores will say, we understand this, but we don't feel comfortable to talk about these issues. Or we may experience the same issues that we are talking about. We have experienced it and how we deal with it. So the first step was training them. And this actually here in this picture is our first training day. I think Claudia was there on that first training day. This was the last in-person training day. And so through this process, the trainings, as typical in promotores ways, which sometimes happens at 7 p.m. and finish at 10 p.m. We have kids around. We have family members around. We have to do it on the weekends. We have to adapt. Even though Claudia will actually drive, I think, an hour plus to come to our trainings in person at that time. And the idea, originally, we focused on these specific topics. There were 6 original topics that were decided by the promotores, that these were the topics. And there are many trainings like a mental health aid kits. There are other trainings specific on mental health, but the promotores wanted a training for them that was culturally informed and that will address specifically the issues within our community and the issues like how stress management means and what does it mean for our community. What are the cultural factors that influence this? So the trainings before COVID, there were 5 topics, but then the last topic was when we talk to them or we teach them and we learn together how to talk with the community about these experiences and these conversations. Then after, never we planned more trainings than that, but after COVID hit us, we moved these more trainings and ongoing trainings to Zoom. And the trainings has been related to what the promotores consider appropriate, but also related to COVID-related issues. For example, grief and loss. Fear and misinformation was our last one. COVID and mental health in general. And so the idea with these trainings is first that we help with having trainings to increase knowledge. But knowledge and information alone, education alone doesn't change behavior. So one of the things that we do is we find different ways to practice, to have conversations, to engage in tools to empower the promotores themselves. And one of the things that we do in every single training is we make sure that the promotores learn skills. It's not about knowledge, it's about skills, like how to talk with somebody, how to validate, how actually can you teach, how can you help somebody that may be feeling a moment of anxiety? How can you help them with a deep breathing activity, a deep breathing exercise? How can you make sure that you are not giving consejos, advice, but instead listening? And then the other thing that we also focused on was on sharing resources and for the promotores to be able to help the community reach the mental health service available to them in the community. So I will not discuss much. This PowerPoint is available for you, so you can see our curriculum, and see the different things and methodologies that we use. But being this a Promotores de la Iglesia program, we have a very strong focus on spirituality, and then we also have to make these trainings understanding that the promotores and us, many of us as well, have experienced many of these issues or are experiencing many of these issues. If we are talking about intimate partner violence or healthy relationships, we know that many of the promotores may be experiencing this. And we have a very similar topic, and we have every topic has, we create the agenda or the curriculum in a way that will be replicable and easy to adapt to other communities. So, but I think what will be important for us to know is what has been this training for the promotores. So these are some examples of what the promotores have telling us in our research about what this training means. But we would like to ask Claudia, what has been these trainings for her? Entonces, Claudia, en este momento quisiéramos preguntarle, ¿qué ha significado para usted estos entrenamientos? Y para usted o para las promotoras, what has these trainings mean to you or the promotores?
Wow, doctora, pues hablar de los entrenamientos es volver a vivir, volver a la vida, es realmente los entrenamientos. Personalmente para mí han sido aprendizaje, empoderamiento, conocerme a mí misma, conocer mis debilidades, conocer mis fortalezas y realmente cuando teníamos los entrenamientos de salud emocional, para mí fue conocerme realmente dónde estaban mis necesidades y dónde había la necesidad en mi comunidad y de qué forma teníamos que ayudar, buscar soluciones. Para mí, yo personalmente cuando empecé a ir a los entrenamientos, en una ocasión dije, Dios mío, quizás en mi casa había una camarita que estaban mirando mi vida, o sea, todas las cosas alguna vez la había vivido y yo misma dije, yo no soy la Mujer Maravilla, necesito ayuda realmente profesional para sacar muchas cosas que me están perturbando, muchas cosas que no me dejan ser yo. Quiero ser diferente y poder ayudar con claridad y con un ejemplo a mi comunidad. Y es así como yo vi la vida de otro punto de vista. Yo misma también busqué ayuda profesional para poder ser un ejemplo en mi familia primeramente y sentirme realmente con la claridad adecuada para poder llevar a la comunidad ese servicio de salud emocional que realmente es urgente, es de emergencia para nuestros jóvenes, para nosotros mismos, para nuestros ancianitos, para cualquier edad. O sea, lo estamos viendo en este país y más que nada en este momento, y haber estado en esas clases es realmente algo que todo mundo necesitamos, que creo que diariamente necesitamos entrenamientos porque son entrenamientos que nos hacen sentir en familia, nos hacen sentir en unión, nos hacen sentir como un muégano, ¿verdad? O sea, sentirnos fuertes, pegados a las raíces y sentir el amor que alguien nos está dando y nos está brindando una mano fuerte donde nos sentimos realmente apoyados. So, para mí, los entrenamientos han sido volver a quizás sentirme más joven, se puede decir así, ¿por qué no? Sentirme con vida y con ganas de seguir ayudando a mi comunidad con mucha pasión y con mucha entrega. Y pues, desde luego, muchas gracias a Providence y a usted, doctora.
Ay, mi placer, Claudia. De ustedes es que siempre aprendemos y nos sentimos igual. And it is from actually the promotores that we learn, and this is a representation of community, and that's the beauty of it. Like right now we do trainings, many of the trainings very late over Zoom, and my students, which I see one of them was here, one of the creators of the program, Alejandra, is there. She's part of the program as well. And sometimes we have been in class and clinic all day, and we come to our promotores training or promotores meetings at 6 o'clock, and los tenemos que echar. 9 p.m., we have to kick them out of the Zoom room, because there is the energy and the love and the support and this sense of community. So we train 90 promotores in the first wave in different counties. We train 90 promotores in this 30-hour curriculum. And then since COVID, we have been able to do more trainings because things are not as difficult. Like before, when we were doing trainings in person, les teníamos que dar de comer. We had to feed them. Now we don't have to. We had to find childcare. We had to figure out like the materials. All of these things, actually, trainings were harder for us as creators when we were in pre-COVID. We have Delfina and her team were amazing in helping the promotores, actually get into Zoom and doing the different things that we needed to do. Actually, the date that we closed here in the state was on the 13th or 11th of March. That was with the train. We closed in the state due to COVID, and less than 3 weeks, we were doing our next getting together now via Zoom, thanks to Delfina and her team for being able to do and help the promotores engaging in this community. So the next thing that we were talking about are the charlas. So the first was doing the trainings, and the second portion of the training was to do the charlas. And these charlas, we here see charlas before COVID. Here we see Alejandra. The idea with, maybe it's Claudia there. Is that Claudia too? Oh, Claudia and Alejandra. In the original idea was, after the promotores have received this training, now with the students and myself, or just the students, the creators of the curriculum, we go together to the community to start the conversation about emotional health, following the same format, but community-based of the same topics that the students, that the promotores were trained, with a very strong emphasis in skills and helping the community just have the conversations, and then later on, helping them getting into mental health services and emotional health services if they need it. And one of the things, and we did at Use Popular Education, we did the trainings, the charlas with a lot of preparation, a lot before with the promotores and the students doing the charlas together and presenting information together. And we have the format the same way that we had with the trainings, in a way that can be replicable in other communities or with other topics. And the charlas actually were very, very popular, but then we have to change to COVID. But before we have to change to, because of COVID, we changed to charlas via Facebook. And we were one of the first ones doing charlas via Facebook. In this case, the promotores and the students have a different relationship. We could not have the promotores anymore doing the same level of discussion. Instead, the promotores are the ones that prepare the questions, ask the questions to the students, and the students complete the questions, respond to the questions. Today, we have delivered about 10 charlas, and we have reached close to 10,000 people, actually more than 10,000 people now in many countries. And one of the interesting things about these charlas is and after COVID is now that we are able to do these charlas based on what the community is asking and based on the issues with COVID, related to COVID. But we would like to hear from Claudia again. ¿Cuál ha sido la experiencia con sus, por medio de las charlas? We would like to hear from Claudia again about her experiences in regards to the charlas. This one is the last charla of last year when Alejandra and Claudia were talking about how to support your emotional health during the holidays, this being a difficult time. Claudia, si nos puede compartir cuáles han sido sus experiencias al ser partícipe de estas charlas.
Bueno, primeramente para mí la experiencia antes del COVID, pues realmente era llena de motivación, porque ver las caras de las personas al principio, pues con muchos tabús, con mucha pena por hacer preguntas, pero después llenarse de valor y hacer las preguntas, y más que nada pedirnos un número de teléfono para hablar con un profesional, para mí era una bendición grande, y conectarme con la comunidad y saber sus problemas, sus malas experiencias o buenas experiencias, para mí era gratificante, porque de esa forma me daba cuenta que realmente existía una gran necesidad por la salud emocional y que estábamos en el camino correcto para seguir ayudando, tocar más puertas a organizaciones, a más estudiantes de posgrado, a más promotores que nos pudieran apoyar más, hacer una cadena fuerte, ahora sí que de acero inoxidable, para que fuera fuerte total y nada nos destruyera, seguir ayudando. Después, desafortunadamente, vino el COVID y nos quedamos, como todo el mundo, tristes, con mucha ansiedad, con mucho estrés. Vimos realmente la necesidad que nosotros mismos teníamos, y gracias a Dios que usted, doctora, se puso a darnos guías de respiración, ejercicios de respiración por medio de Zoom. Seguíamos con nuestros entrenamientos y surgió la idea tan hermosa de poder llegar a la comunidad por medio de Zoom y lógico por Facebook Live. Para mí me aterró esta idea para mí personalmente, porque yo no soy muy fanática de la tecnología, realmente no sé nada, yo me dedico a trabajar, mis hijos, las charlas, etcétera, pero jamás me imaginé que yo iba a estar frente a una cámara y pues dije, ni modo, Claudia, si eres latina, rompes muros y tú llegas, entonces vamos. Y le dije a mis hijos, hijitos míos, ahora ustedes me van a enseñar a mí. So, ¿cómo abro esto? ¿Cómo abro una página de Facebook? ¿Cómo hago esto? So, así fue que llegamos a la comunidad. Y ver la participación en el chat con la comunidad, ver el sinfín de preguntas y más que nada, lo más grande para mí, ver conectada a mi familia en Michoacán, ver conectada familias en Puerto Rico, ver conectada en todos lados, Guatemala, El Salvador. Oh my God, dije, esto es lo que realmente benefició a nosotros. Este COVID, vamos a sacarle provecho, vamos a llegar a tocar puertas hasta donde sea y seguir conectadas con la comunidad, no dejarlos y seguir buscando más temas que realmente están ahorita afectando a nuestra comunidad latina, desafortunadamente. Pero gracias a Dios, tenemos un equipo muy fuerte, pero también queremos seguir invitando a que los demás promotores, los demás, ahora sí que psicólogos, estudiantes de posgrado, organizaciones que ayuden tal vez económicamente, no sé de qué forma, pero todos hacer un equipo fuerte que podamos ahora sí que cambiar esas lágrimas por sonrisas y por hacer realmente familias llenas de salud emocional, quitar a nuestros jóvenes de las drogas, quitar a nuestros niños de ver violencia doméstica y que las mujeres podamos decir basta ya, que los hombres puedan decir basta ya, no más violencia, vamos adelante. Y eso para mí es lo más gratificante. Somos voluntarios de corazón, pero amamos nuestra comunidad y eso es lo que nos hace la diferencia. Somos mexicanos o de cualquier lugar, aquí no existen razas ni nada que pueda hacernos decaer. Somos fuertes, estamos aquí presentes y vamos para adelante a lograr lo inalcanzable, lo vamos a hacer realidad. Con la ayuda de todos, claro que sí se puede. Adelante.
Gracias, Claudia. I feel so empowered right now. How can you not feel empowered right now after hearing Claudia share this? But a couple of important things that we are going to cut, I think, pretty close so we can answer some of the questions that you have in the chat. One of the things that is important to say is that actually the charlas, I will share the charlas link for you to visit us. The reason why they have been successful is because we were already doing this in the community in person. And so that was something. But the other thing is, even when Claudia, it's a lot of work. When we do the charlas, for example, you saw Alejandra and Claudia. We prepare a script, we meet with Claudia, we help her how to be in camera, and it's very organic. We actually do it all ourselves, and we have one student in the back helping with all the technology, psychology student, and another promotora encouraging everybody to participate and giving saludos. And so it's 4 people in reality doing this. And we do raffles, we do dinámicas, we do many activities, and we actually can see that even in a single charla, sometimes we have 120 people commenting, asking questions, and we don't have enough time to do them. We used to do charlas of 1 hour. Now we do them 30 minutes because there are so many charlas and so many things happening in Facebook. But all our charlas have kind of 5 components. What is stress? What is anxiety? How does it manifest? What are some of the symptoms? What it looks like? How to help myself or help somebody else dealing and experiencing this? And then we practice an activity, like a mindfulness activity, a culturally adapted activity. And finally, we do raffles, dinámicas, questions, and so forth. We're going to stop here. We have much to share. And also, I want to add the last thing is that we actually try to connect with community with the community, with the mental health resources that are available. We would like to share more, but also we want to give some minutes for questions because it seems that there are several questions in the chat. Maribel, can you help us with some of those questions, please?
Sí. Gracias, Ruth. Fill out your evaluation, quick plug. Pero some of the preguntas that have come in, Ruth, have been, like, people are so impressed with how many folks have been attending your events. Can you give us any tips on how to best get, like, engage the Latinx community, how to get folks involved there? Y luego there's another pregunta that was really popular around how did you get leadership buy-in, especially for like health centers? How did those partnerships develop, and what are some of the tips there también?
Yeah. So in regards to the tips, some of the things that have worked is that even when the two promotores involved in each charla are available, all the team is supporting. So we have in the audience promotores, like they know when their compañeras are going to be part of it. And they invite their family members, they invite the church members, so it is not only from the two people involved in that charla, it is the entire promotores team being participant. And they are the ones commenting and asking questions as well, because we want to model, and we want the promotores to model that vulnerability and what it's like to ask these hard questions. And we have reached, I think now 9 countries, and we know that many of those 9 countries that we reach is por los promotores. It's just because I remember the first time that Claudia did her charla, we will see the saludos from her family in Mexico, and so many people in Mexico just coming and tuning in. So, but maybe it's an uncle, a cousin, the one that is watching, but that cousin uncle shares it with another person, and that's what has been successful. The other thing is we keep them very focused on basic information and skills. Basic, we don't want to, and then interaction. It's not just Claudia saying good morning and Alejandra, who is there, just start talking. It's actually a collaboration and a conversation between both of them. And Claudia may speak a little bit about her experiences, and Alejandra also bring her perspective as a person of the community, as a psychologist, but also as a person of the community. We have a wheel that we actually use for raffles. So we try to make them interactive as possible. And Delfina, I think, has something to add to it.
Yeah, and I think another part, really key component when this whole initiated back in 2018, Maribel and the whole group, is that the promotores, this Promotores de Salud program has been building relationship with communities, for the past 12 years. And it is, the promotores have been, we've been building capacity, training community members to be promotores de salud. The program in total, we have about 140 plus promotores that are active as volunteers, in their community. I mean, at times, whenever we always look for ways, how do we provide stipend? How do we compensate them for their time? It's not enough, what they're being compensated is not enough, but we look for ways how to do that, to provide that support, ongoing support for them to continue on. And so it's that relationship that they've established for such ongoing years with community. So by the time we brought this whole conversation about mental health, traer la plática, something that's very difficult to talk about, to bring into your community, to kind of start something, is it's almost like the promotores already had that network. They already had the existence of network. And so it was a smooth transition. It did take a little bit of time to kind of get community to come to the charlas. The promotoras did a lot of work, even them being known and respected and recognized in the community. That took some time. And it just the ball started rolling afterwards. So I think that was another really key component.
One of the things that we have done also is that we have been constantly speaking about promotores in every single thing, in every healthcare setting, so they see the importance. And now actually we have organizations even wanted to work with us, asking if they can be part of the program just because they see the value. Promotores are volunteers, but at the same time, we have done our best to find grants, and they get a little stipend for the charla. It's little, but it is better than just doing this for nothing. So we actually have been able to secure for a couple of years grants to help the promotores, and also for the raffles to pay for the students that are doing this. And so in them, I think the biggest thing that has helped successful is all the collaboration. We also have an extensive collaboration with more than 90 community-based organizations that believe in our work. So they help us leverage also the work.
Mm-hmm.
And I think we may have only 1 minute left for maybe another question. And I share my email address for questions. If anybody have questions or comments, things that we can share with you, please reach out to us.
I think there's a question asking about what is the key to retain so many promotores. I think that's a really great question, Marcela. And what has been supporting the program is that having this sponsorship, Providence having sponsoring the program, and continuously our job is that we raise the promotores' voice. We show the importance of the work that promotores, how essential they are, to have them be integrated, be part of this, be part of the community, be part of the community health needs assessment, but also be part of addressing, of building, part of the projects that we want to, the Providence or our CBOs, our partners want to focus. I always tell people, I tell organizations, you need promotores voice, you need community voice. We're here. We're here to do that. We're happy to hold groups, bring in groups of promotores, because they really truly love, being part of that. They really see the importance. They have a great passion to advocate about the needs, because their lived experience, their ongoing needs that we have as communities. So that's been really important, is that sponsorship. When you have that kind of support from a healthcare system or an organization that can really give that budget for it to be an ongoing program, and part of it is that you tell the story over and over again. Bring that attention to the upper leadership, and we've been, that's been our job. Our job is to share the promotores' work, share this project, elevate the project, internally within Providence and with the other CBOs that we work with.
Thank you so much. We appreciate it. Reach out to us, visit our charla. Our next one is how to deal with the returning of classes I don't know in English how to say it, but to returning in-person classes. Actually, that is the next topic, when we're going to be talking about the emotional difficulties and the strengths that families may be experiencing as children are going back to school. And our charlas are at 6:30 Pacific Standard Time. I just shared the information right there. Thank you, everybody, for joining us today. Para mis copresentadoras, gracias, Maribel, and also Soraya, and everybody that was behind the cameras. Thank you.
Yeah, thank you, everyone. Gracias por tenernos aquí. Thank you.
Gracias a todos.
Fue un placer.
Abrazos.
Gracias.